Well, that's the tune, and you may know what that means on WJER radio. That is the Thompson twins, and the doctor is in the house. It's Dr. Tom Rogers, and Dr. Rogers from Cleveland Clinic Union Hospital. That tune means it's time for Medical Minutes on a Thursday afternoon. Welcome back.
Hi, Kelly.
Great
Thank
to have
you.
you here, and you came all the way from across the street.
All the way across the street. It was a beautiful day, though. We could have
Yes.
kept walking. It was so
Well,
nice today.
You know, I've been telling you how we are so appreciative to be the neighbor of Cleveland Clinic Union Hospital. And today, Dr. Rogers, we'll just get right to it. How about if you announce our guest for today?
Absolutely. So we're changing things up a little bit today. We wanted to talk about our history and about things going on at Union Hospital. And no better to bring in, but our Senior Director of Operations, our Chief Operating Officer, Jeff Pike, will be here today with us. So
Thanks,
we're
Tom.
welcome to Jeff. Jeff is he's a lifelong Ohio resident. Went to school at Coventry and then to Kent State and Ohio State, and still lives up in North Canton. Comes down every day. We've almost tried to pass each other sometimes on the highway, but is always been a great addition. Been working with us for a little over a year and a half now as our Senior Director of Operations, and really does a great job. But you know, an old building, he's got a lot of work to do. So lots of things.
So, by the way, how old is Union Hospital, and what are some of the routine things you need to do in a hospital like Union Hospital in Dover that needs a little infrastructure refreshing?
And that's a great question. Well, you know what's cool is that, you know, the Union Hospital first started in 1906. And so the original building is just down the street from you. And then in 1922, Jeremiah Reeves, of course, who was a huge supporter of the hospital and of healthcare, donated some land to us. So in 1922, there was he had a kind of like a little shed that was there that became the first part of our hospital. In fact, we were looking at today. So in 1922, we started our building, and then next to it, there was a building from 1950 that's kind of attached to it. And then another one from 1970 makes a little corridor or a little quad next to our inside, right next to the ORs. So pretty interesting that that's there. But we've had, let's see, the ER was built in 2016, so different phases. If you look in our administrative hall, there's a bunch of different spots of when our buildings were built, so it's kind of cool. But
That hall, by the way, Dr. Rogers, that's worth a visit on its own. I mean, whether you need the hospital for anything else or not, that history timeline is amazing. I'm thinking back to names like Carrie Gardner and others. I'm forgetting someone right now that made that happen, but that's a history lesson. Every high school history teacher should take their students along that hallway.
Absolutely, it's really cool. And then our building has all the old pictures, so we're waiting on a new one too. We'll take a new picture from from this year and we'll compare it. It's so cool to see the comparing all the times from the as you build onto a building. But what's interesting in our building, anytime you have an old building, there's a lot of work that has to be done behind the scenes. So when you take down a wall, anything can be back there. So unfortunately, plumbing, electric, all those things that have to be done. For instance, our hood, our kitchen hood, which is our exhaust and our suppression system, so we can cook in our cafe. We started that project about 10 months ago. It should have been about a 10-week program, and it's unfortunately we ran into a lot of things with the shaft, a lot of things with the walls, asbestos, and all those kind of things. And so we are excited, though. Should be coming up soon, and we hope that the cafe will be open again soon.
Fantastic. Well, again, all good things take time, right? And you want to make sure things are done correctly. You know, with any kind of refurbishing, it takes a little bit longer than you may expect it. And speaking of the Union Cafe, what kinds of things will you plan to offer? Am I smelling a good thing and little smoke? No,
Yes, we love the smokers. So, Chef Mike, who was here before, now we have Chef Casey. Evan Schmidt helps to manage the cafe. What a great group of employees we have. Our caregivers in our cafe, despite really what we say working off of hot plates for the last 10 months, still have some of the best food scores in the enterprise across Cleveland Clinic, which is really amazing that they've done as well as they can. They really shift, they pivot, they adjust, they're flexible, and they still produce great food. Our patients really love it. But once we get this new hood, new convection ovens, pizzas, smoked salmon, he'll be able to do some pulled pork and all those kind of things. So they're very excited about using this equipment. So we're looking forward to when the hood is open completely.
And again, it is open to the public now, even without those changes?
It is. And in fact, we welcome people to come over and have lunch with us. And we used to have a lot of meetings, I think, before COVID. But that would be something too that we'd like to be able to do. If you want to have a meeting there, we can, see if we can utilize some of our meeting rooms and conference rooms too, but it's going to be great.
Fantastic. We are on the air with another edition of Medical Minutes, and again, Dr. Tom Rogers with our guest today, Mr. Jeff Pike. Jeff, if you want to take the microphone, tell us about what Union Hospital in Dover is doing to improve the clinical areas.
Yeah, we have some very exciting projects coming up around clinical expansion. The one that just kicked off about 2 weeks ago is to really update our current endoscopy room, build an additional endoscopy room, high-level disinfection. Obviously sterilization has become very important, and we want to make sure that we keep all that stuff clean. So we're going to build a really high-tech, high-level disinfection, and we're going to update our bronchoscopy room as well. So I know those are some large words, but what that essentially means is that we're going to have 2 rooms. We're going to be able to do all kinds of minor procedures for patients to get them in and get them out quickly. And then the bronchoscopy room really allows us to do a lot around pulmonary and whatnot. So anyone who's had a colonoscopy or an upper GI type scope, we're going to have the most state-of-the-art updated rooms to be able to do that. That project is really slated to finish up sometime in the September, October. So we'll be working on that all summer long.
Fantastic.
And really excited about it.
Well, again, for those of us who are here in the Tuscarawas Valley, it's so nice to not have that 2-hour drive out of town for those procedures. Mr. Jeff Pike, let's talk about some of the lobby areas. Are you going to have to hang up that sign, the Pardon Our Dust sign in the lobby area?
I think so. We have some amazing concept drawings that we've done around the lobby. I know the lobby's one area that we had slated before COVID to have finalized, and now we're going to get back into that project. It's going to be a 3-phase, 3-year program. And in the first phase, we're going to be largely focusing on our main doors, our entry areas, where we store our wheelchairs, where people sit, our waiting room areas. So by the end of the 3-year period, we'll have moved from there through our lab, our radiology, and our pharmacy areas. And what we want to do is give it a completely modern look, open sight lines, easy navigation, enabling patients to be able to walk in, step up to the front desk, and to be easily able to navigate anywhere within the hospital. It's going to be a fantastic project, but it is going to be a 3-year, and we will not have the main entrance closed or anything, but we just need to take a couple of years to probably do it right.
Okay, that's really good to know. Again, Mr. Jeff Pike and Dr. Tom Rogers from Medical Minutes topics here today, all about the hospital itself. One more topic here we really need to talk about is conserving energy, which is a situation we all really need to focus on more, decreasing the carbon footprint of our local institutions. What is Cleveland Clinic Union Hospital doing in relation to energy consumption?
Yeah, it's a perfect time of year to bring that up with summer. Obviously, we all want to, have air conditioning, and the load on our electrical grid this time of year really gets maxed out. So actually we've been at it quite a while, but the Cleveland Clinic's really making a new initiative in all of its hospitals to be very cognizant of its carbon footprint and its energy utilization. Some of the steps that we take that we currently do is we use LED lighting, particularly in our 24/7 areas. We utilize outside air during the night to help cool the organization down, which is a very efficient use of that. And then any project that we get into, one of the standards that we select, either whether it be medical equipment or any kind of facility or even a roof, is R value and how much energy those equipment use, and that becomes one of the standards by which we select all of our equipment. So we really try and stay focused. We're focused on the STAR program that Ohio has around energy utilization, and there's just an awful lot that's going into it to try and make us as efficient as possible.
Fantastic. I should probably make another day to talk to you about employment opportunities with all the projects you have.
Yes.
So again, thank you so much for another great few minutes about the information, all that's happening at Cleveland Clinic Union Hospital. Watch for the changes. Stop in for a bite in the meantime. Dr. Rogers, Mr. Jeff Pike, thank you again for being here with us today. Really appreciate your information.
Thank
Kelly.
you. Thanks
And
for having
again,
us.
if we have any questions, we can always contact you at Cleveland Clinic Union Hospital. How do our listeners get a hold of you?
Again, the best way is probably through our main number, the switchboard. They can direct you to whatever clinic or whatever organization you want within Cleveland Clinic Union Hospital.
Fantastic. And again, the website is full of great information. Have a wonderful rest of the week, and I think I can see that we will see you next month. Another visit in June, perhaps?
Absolutely.
All right. Dr. Rogers, Jeff Pike from Cleveland Clinic Union Hospital on today's Medical Minutes.